Why is a colposcopy performed for HPV changes? Imagine your doctor finding something unusual during a routine cervical screening. That's where a colposcopy comes in. It's a special exam that helps doctors look closely at your cervix, vagina, and vulva using a magnifying instrument called a colposcope. This procedure is often recommended when tests like the Pap smear or HPV test show abnormal results. Human papillomavirus, or HPV, is a very common virus that can infect the cervical cells. Some types of HPV, especially high-risk strains, are linked to changes in cervical cells that might lead to cervical cancer if not checked. When screening tests detect these abnormal changes, a colposcopy allows healthcare providers to examine the area in detail. They look for areas that seem suspicious or abnormal, which might not be visible to the naked. During the procedure, the doctor may apply a mild solution to the cervix to highlight abnormal tissue. If they see areas that look unusual, they might take a small tissue sample called a biopsy. This sample is then sent to a lab for analysis. The biopsy helps determine how severe the cell changes are, which is classified from low-grade to high-grade. Low-grade changes, called cervical intraepithelial neoplasia grade 1, often go away on their own and might just need regular follow-up. High-grade changes, like cervical intraepithelial neoplasia grades 2 and 3, have a higher chance of progressing to cancer if left untreated. The main goal of a colposcopy is early detection. By identifying abnormal cells early, healthcare providers can decide whether treatment is needed to remove or destroy these cells before they turn into invasive cancer. It is a quick, minimally invasive procedure usually done in a doctor's office. In essence, a colposcopy for HPV changes helps confirm the presence and severity of abnormal cervical cells, guides decisions on whether treatment is necessary, and helps monitor the effectiveness of any interventions. It plays a vital role in preventing cervical cancer by catching precancerous changes early. Remember, if your screening tests show abnormal results, talking to your healthcare provider about a colposcopy can be an important step in protecting your health. Always seek personalized advice from medical professionals for your specific situation.